Hi, everyone. Welcome to the Wellness Institute of Neurodevelopment. I'm Kelly Baltazar. I'm the office administrator here for WIN Houston and for WIN Puerto Rico. I'm going to introduce our doctor, Dr. Carmen Baez Franceschi. She's the founder and chief executive officer of the Wellness Institute of Neurodevelopment in Houston and Puerto Rico. She is 25 years at the board-certified pediatrician with licenses in Texas, Florida, and Puerto Rico. As you can see, she has 15 years specializing in the treatment of adolescents and adults with neurodevelopmental disorders. She is also the recipient of multiple scholarships from the National Institute of Health, National Science Foundation, NBRS, and among others. She is also the creator of the Franceschi method. She's a special guest speaker in the National International Conference, well, among lots of conferences around the country, of course. And she's also an expert guest in national and local media. She's an author of the book Comprehending Autism. And without further ado, I'm going to go ahead and introduce Dr. Carmen Baez Franceschi.
Good morning, everybody. Thank you for joining us today. We're going to be discussing what are the latest treatments in autism. I want to first to review the increasing incidence that we're all aware that now recently it raised to 1 in 36 children. And something that I have been trying to help, it's that we're missing on helping the children to progress faster. So there is a need of more individualized holistic care. And one of the things that I see all the time is that there's no consensus of what the theology is, but now after so many years, we are seeing that everybody, it's seeing similar results in the studies, the clinical studies that are being done. And they are related to the following things. We're finding genetic mutations associated to autism. Recently, there was a study that published that they found more than 1,000 genes related to autism. We also see that consistently there is immunologic problems. And what I mean with that is inflammation, causing activation of the microglia, that's one of the type of cells that causes a lot of inflammation. They're talking about environmental exposure, and I'm talking about exposure to chemicals, to preservatives, additives, and other things in our water, in our food, etc. And this is affecting mechanisms of detoxification in the body, in energy production, and that it's called oxidative stress. And we're seeing a lot of metabolic dysfunction, and as I said, significant problems with detoxification. Now, with the progress in genetics, we're able to demonstrate this, and I'm able to see it in each one of my patients by specialized genetic testing. Decreased methylation has to do with metabolism of vitamin B12 and folate, and we see mutations associated to these vitamins, which are the most important vitamins for the neurological system. We're also seeing other systems involved, and one of them is dysbiosis or leaky gut syndrome. And this has to do with how the gut gets affected because of the inflammation. And why is the gut so important? Because that's where our immune system, where the majority of the immune system chemicals are produced, also neurotransmitters, but as important, it's where we absorb nutrients. And also the gut should not allow chemicals to get into our bloodstream if they're not safe. And what happens when there's leaky gut, there's a change in our microflora, and there's increased growth of candida, and that causes inflammation that makes little holes in areas that we shouldn't have any pass through, and chemicals that are not supposed to enter our system are entering. This study was recently, it's a study from 2023, last year, that it's something that we have been talking about for years, but also that found that not only the child is going to have neuroinflammation related to what he's exposed, but more importantly, this starts before they're born because of the mother's immune system activation. And actually, they found in this study, which is a very thorough study, that those chemicals that stimulate the immune system transpass to the baby before the baby is born. This study also supports how different factors of the environment plus familial genetic variants, everything works together to develop into immune activation, oxidative stress, mitochondrial dysfunction, which is the organelle in our cell that produces energy. And all these things work together and get you to develop the symptoms that are seen in autism. In this part, in this slide, I just want to talk about how another study also added to everything that we have talked about, stress, emotional stress. And not only this is affecting the immune system, detoxification, and pathways that we already saw, is that what I'm seeing in children that causes immune activation, I'm also seeing in adults with other conditions that are related to autoimmune disorders, related to emotional stress. But in children also, we're seeing it related to bullying, related to, I just saw a child yesterday that the parents are moving to a new house and they change of school, and all these stressors also activate the immune system, and his sensory symptoms worsened. And the only thing that we can find that has changed is emotional. And so what we have learned through the years, I have been treating children with autism for 15 years. And I have seen that we have to change a little bit of how we work with these children. We're used to working in the traditional world, which I'm a board certified pediatrician. So I'm going to always be the basic of the treatment that I do. It's send them to all the professionals that we're used to make sure their evaluations don't show something and we don't miss any diagnosis. And I'm talking about neurologists, developmental pediatrician, geneticists, speech pathologist, occupational therapist, developmental pediatrician. Even though I have seen that the majority of my patients have already gone to all those professionals, I make sure they complete all the protocols and workup that needs to be done before I start working with them. The Franceschi method is based on collaboration. And that's what this slide brings up. It's not only that we're going to work with the medical part, it's that we're going to work with the neurological part. We're going to work with the cognitive skills, social emotional skills. We're going to work together with other doctors that are taking care of this child, and therapists, occupational therapists, speech pathologists, etc. And then we are going to center our findings or knowledge to improve this child, because that's how hard autism is to treat. It needs to be done in detailed, and also it has to be a dynamic process. So when I talk about combining allopathic medicine, that's traditional medicine, with complementary medicine, I bring these slides because everything has to be evidence-based. And everything that I do, we have a study that proves it, but also we use quantitative data like labs, evaluations that prove by quantitative data the process that we're, or the protocol that we're implementing. And this is important because we're going to hear a lot of things, a lot of options of treatment. And in my experience, one, less is more. And two, it's a matter of finding what's right for this patient. What works in one patient doesn't work in the other. Moving forward, one of the big advancements that I have, it has helped me a lot to define the treatment protocol that best work for this particular patient, is genetic testing. Epigenetics has changed, or is changing the way we do medicine, because it allows me to know exactly what this person inherit that can affect their metabolism. And I'm talking about metabolism that affect neurotransmitter production, that affect how the brain metabolizes, for example, vitamin B12, which is the most important vitamin for the brain, but also other pathways that are related to exposure of toxin, detoxification, things that help the body to get rid of cells that are damaged. And genetics has helped me to find out exactly what is wrong with this patient. And in that way, I save time and start protocols that are more effective. And what I mean effective is if the parents start seeing changes quickly. The other thing that it's out there, and there's different medications that we can talk about and supplementation, but in summary, what we're seeing is the body is not having enough nutrients and it's exposed to large amount of toxins. And this is related to mass production of food, things that are in shampoos, clothes, the way that we process even medication. And obviously the stressors that our body is exposed every day. In addition to that, one of the purposes of the treatments that we're gonna be talking about today is decreased inflammation, which is the most common finding of all the studies that are done. Everything that guides us is that all these things that we're seeing causes inflammation of our body, or inflammation in the way of chemicals crossing the blood-brain barrier and affecting the neurons of these children and adults with autism. That's where we want to identify the triggers. One of the things that has been talked about for years is food sensitivities. And there is not consistent clinical studies about this. So one of the things that I'm going to say to this is the best test is the real life test of allergies. And what I mean with that, it's exposure and seeing the changes that this child has in skills, visual contact, hyperactivity, and seeing how it affects the progress of the patient depending on exposure. We use the food sensitivity test, and it's not your regular allergy test, because for years I was doing regular allergy tests and it was not showing me or guiding me on what I needed to do to help the parents find out if there was anything that was triggering that inflammation. So we found that IgG4 test for food panels help, but they are not the panacea. The panacea, it's the parents doing the testing, using this as a guide, and also with the help of a nutritionist. We have found that specific chemicals inside the food can trigger inflammation. The most common known are gluten and casein, but in my experience, it's not the only thing. It's one of the triggers, but other things that trigger inflammation are chemical exposures of chemicals in food, water, and even environment. Like I'm seeing a lot of patients now in Houston with exposure to molds, which I didn't expect. But then after we take them in a protocol of finding out why this patient is having this neuroinflammation. And that includes food, that includes chemicals, but that includes environment. And what I'm trying to do when I create these protocols, which I use testing to prove what it's causing this neuroinflammation, it's things that are going to help decrease that inflammation, but providing also what the patient is not having enough. And when I talk about that, we're talking about vitamins, we're talking about minerals. And when we talk about oxidative stress, that it's the exposure of chemicals that affects how the body gets rid of radicals. Radicals is chemicals that affect your body and cause inflammation. That treatment plan includes antioxidants. And the most potent antioxidant the body has is glutathione. So when we create these protocols for these children, we have to take into consideration all these agents. It's not going to be something that we do without proof, but also we have a purpose. We have a purpose of supplying the body what it needs and getting rid or decreasing exposure of what we think is causing inflammation. I add here IV nutrition, even though I don't use it in children, just because it's an opportunity for adults to have something that goes straight to their blood system that has actually helped us in people that have problems absorbing nutrients. In children, I don't use it because I try to make it no traumatic, and I have been very successful without needing it. But I think it's a great tool for adults. Other things that we're seeing and it's being talked about, it's combining different options of treatment like hyperbaric chamber, pulse electromagnetic field therapy, like I said, IV nutrition, the Vigalin stimulator, stem cell. It's a new thing, which is under investigation right now. But the common, the information I want to relate is, yes, it's good to use other therapies that have proven by scientific evidence that they help, but my experience is not the panacea. And what I mean with that, it helps, but you have to use it in a combination of already working with the metabolism. The hyperbaric chamber, for example, and I'm going to go into this, it increases the exposure of oxygen, which is the most important for the brain among all our organs. The oxygen that we breathe, 20% more or 20 times more, it's used by the brain than other organs. Also, it increases the production of glutathione. Like I said before, most of our patients with this condition, especially autism, have detoxification pathway mutations. So that means their body doesn't get rid of chemicals that we're exposed in food or in an environment in the water like other people do. So the hyperbaric helps with that. And it takes longer done by itself. In my experience, parents that have done hyperbaric chamber therapy, at least 40 sessions. But when I use it in combination with the other therapies that we use in the office, it really helps. It really helps to accelerate the speed of recovery. But by itself, I don't want you to think that's going to make a huge difference. It's going to help the body to heal, but without combination of stimulating the brain, it's going to be a long process. So they usually, by itself, it's going to take like 40 to 60 sessions just to see an improvement, which I'm not pleased if I don't see a tremendous improvement, but I do use it as a combination. The same goes with pulse electromagnetic field therapy. Pulse electromagnetic field therapy was discovered by NASA like 30 years ago. And they discovered after they saw astronauts coming back from the space and seeing that they were not able to walk. They found out that the gravitational force of the Earth helps the body to charge the cells. So we use it exactly for that. There's multiple indications. You can find it in our website or you can just Google it. But basically what it does, it gives that electrical shock to the cell just to wake up. And that's how I use it. It can improve, obviously, in lesions related to sports, accelerate bone healing. But the most important thing that I use it for is to increase circulation, increase inflammation in children with autism. I actually use it particularly higher intensity when I have children with low tone in the areas of the mouth that we're trying to make them speak. And I have been able to combine it with the hyperbaric chamber and working with a very knowledgeable speech pathologist. We have been able to accelerate the progress on speech to the point that she has not seen in 20 years of experience. And that for me is very reassuring because it tells me that these cells can regenerate and you can actually stimulate that they develop faster using these technologies. Obviously, we accommodate this to every case and it's depending on the severity. The idea of all these treatments is to use evidence-based technologies and methodologies. And one of the messages that I want to communicate to the parents seeing this conference is that you always want to be safe and you want to use evidence-based and you want to consult with somebody that has experience because that will save you a lot of time and money. And also you want to accelerate the speed of acquisition of skills. And I use this and I tell this to all my parents. It has to work in less than 3 months. If it by 3 months is not working, you need to change it. And I always say, including including me. And the reason why I say that, because this is a fluid process where I'm always evaluating the patient and making sure that I see progress. When you see progress, you're doing the right thing, what the brain needs. This is another technology that has been out there for years, more than 30 years. And this technology, what it does, it creates a map of the brain activity of the person, and it creates a brain map. And the idea of this is to find out where that brain activity is not normal compared to thousands and thousands of brain mapping. And this works like training with positive reinforcement. So basically, the computerized system makes a map of your brain activity. And then when your brain is not acting the right way, it just gives you a negative reinforcement. In this case, they're watching a movie and it decreases the sound and the image gets blurry. Surprisingly, by itself, I haven't seen significant changes, but in specific things, I have seen very helpful changes that accelerates the acquisition of memory, works with attention. I use it, the particular one that I have in the clinic, I use it for children that have visual motor delay like dyslexia, because we have one that stimulates with frequencies of light and anxiety. I see it working significantly well for anxiety. Obviously, I combine it with everything that I have mentioned before, and I target it for specific symptoms and for in specific cases that I think it will work. In most of our programs, we use a technology that stimulates speed of recovery, but in the Franceschi method, I complement it with this system, but I program it per patient and I program it according to results, because it has been demonstrated that you can stimulate the brain using filter auditory frequencies. By itself, it's not the panacea, but when you combine it with making the biochemical connections of the neurons with a specific order of exercise that they have to do with how the patient results are. And we have a very thorough neurological evaluation that takes even into consideration early stages of problems like early development or infancy demonstrated by primitive reflexes, and you use frequencies of sound related to that part of the brain that was injured, we have seen incredible results that we have been able to replicate patient over patient through the years, but we have to constantly measure it and adjust so that we can get the results that we're looking for. So it's a good source of stimulation. And again, all these technologies by itself are not the panacea, but when combined, using result as a guide, you can make them help you achieve the results that you're looking for. I also have learned through the years that you have to make it fun. And also, the brain doesn't function by parts. So I partner with speech pathology, occupational therapist, speech physical therapist, and I leave the children working with them to continue working the skills. But my job is to wake up the brain. So I have learned through the years that the brain has to be stimulated all together, because our body doesn't work by parts. Like when we're talking, we're moving our hands, we're thinking. Well, that's the same thing that happens to your brain. So when I'm working with a child, I'm not only working with their motor skills, I'm working with their emotional, I'm working with their self-esteem, I'm working with their behavior, I'm working with their visual motor at the same time that I'm working with primitive reflexes, because everything has to be developed in a specific order, but we have to take care of everything the child presents. And what you see is the brain organizes itself and progresses faster. The same goes when I'm developing speech and when I'm working with executive functions. And I use this technology that it's computerized and measures the speed of reaction of a patient, but also they don't know that we're measuring them because they're playing. So fun and having the family together, it's a big key to our success. I want to also talk about other novel treatments that are coming out, and they're in the clinical research right now, but they are promising and also very interesting. There's targeted drug development that actually is going to be working to try to influence the neurotransmitter systems and to try to balance, because we see a lot of problems with neurotransmitters related to dopamine, serotonin. And when we give traditional medications, since these patients have so many problems with even chemicals that are used as preservatives in medication, or because that's not exactly what they need and they're very sensitive, I usually try to stimulate the body to produce that neurotransmitter. But I'm hoping that with this new research, we develop more medication without side effects that can help us actually give better levels of neurotransmitters. The other thing that is being tested, and it's monoclonal antibodies or chemicals or medications that help decrease that neuroinflammation. And that is important because across the board, what I see, it's the neuroinflammation. It's very high, up to the point that some of them have developed seizures or tics, and they improve as soon as you decrease the inflammation. I have had patients that I have sent to the neurologist because I think they have a seizure disorder. By the time they get to the neurologist, all the involuntary movements have disappeared because the neuroinflammation has improved. So biological therapies that decrease inflammation, it's a great it provides us a great tool to help in the future to increase that control of inflammation. There are other medications that are being used for other things that we see very often, and one of them, it's overgrowth of fungus in the gut, or problems with the gut flora related to the body not being able to balance. We have good bacteria and bad bacteria in our gut, and the immune system keeps it under control. When the immune system is overacting, like it's overacting in autism because of all the things that are making this immune system overreact, that balance of good bacteria and bad bacteria is lost. And overgrowth of candida, it's seen. And there's treatments that I use that are traditional medication or botanicals, but also there's people that are exploring with other medication like itraconazole. And actually we had a patient, very severe autism patient, that we tried it, and it was not the panacea. Yes, there's clinical studies, and there's a case study that prove of a child improving, but when we get to the real life and see multiple patients, it depends on the patient. And the same happens with surnamine. That's a medication that recently was used in some children with type 2 and type 3 autism. And they were using it to decrease inflammation because they were seeing that in other cases it was decreasing inflammation. And they gave it as an IV infusion. And they saw progress in a specific dose. In a lower dose, they didn't see anything, but a higher dose, they saw improvements in cognitive skills. But again, there was a concern of side effects. They saw moderate to mild side effects. And this is what we have problems with developing new treatments for autism, is that not they all don't work in the same in every patient. And then we have to do it specific or tailored to the specific case, and watch for progress and also for safety. The next thing that I'm going to talk about is stem cell therapy. Core stem cell has been explored in the last few years as an option of treatment. There's a big study. Duke University is conducting several studies, not only in autism, but in cerebral palsy, rheumatoid arthritis, and other conditions that have to do with inflammation. And they have seen promising results. One of the things that stem cells bring to the table, it's decreased inflammation chemicals, but also safety. And this is something that we see as an option of treatment. I'll talk a little bit more in a little bit, for children that are more severe. Exosome therapy is another therapy that we are exploring also. It's in clinical studies yet. The exosomes are vesicles that are nanoparticles that are very, very, very small, but they carry anti-inflammatory agents. But the good news is that they can cross the blood-brain barrier, which is something that has been a problem when you create protocols of treatment. You need to make sure that it gets to the place where there's neuroinflammation. So exosome, which is in clinical studies yet, it's promising to be a good option of treatment to decrease inflammation. And there's studies showing possibility of intranasal application, so it's not invasive. And there's some studies that is showing good levels of exosome crossing the blood-brain barrier and getting to the areas that we need to decrease inflammation. Other things that are being explored have to do with technology, virtual reality, but that comes into the other arena that is the therapeutic world, trying to help in developing social skills, communication skills, and the same goes with artificial intelligence. I'm not a fan of technology to develop skills in autism because one of the things that they caress is social skills, even though I think they can be used for specific things, and I'm open and receptive to learn more about it. I think my message is we need to not be the only thing. We really need to get kids out of technology. I use technology to help, but I don't keep them in technology because it doesn't stimulate areas of the brain that have to do with motor skills, with other things related to socialization. And that is going to affect the progress on executive functions, on speech, and the skills of emotional maturity that we're looking for. Here, there's also addressing dietary and gut microbiome adjustment that I already mentioned, because there's evidence emerging that suggests that this is going to help, even though we have been doing it for years. The evidence is not completely clear because there's not enough studies. And the reason why there's not enough studies is because the studies are very expensive, and usually the people that are pioneers in the arena of autism are physicians that don't have the resources of big, large corporations. But we are seeing new studies all the time from universities. We and WIN were starting to submit clinical studies, double-blinded, controlled, to be able to have more data and more published studies so that we are able to provide evidence of the things that we're seeing with these novel treatments. I'm going to talk a little bit more about cord stem cell, which is a protocol that we are going to start getting involved in a clinical study, a double-blinded control study, and a pilot study, because I want to make sure people understand this. We only are going to be using FDA-approved cord blood cells. And this is important because I see a lot of marketing about a lot of cord blood cells, and we have to be careful with that, because stem cells have to come from a safe source, and it's not for everybody. We're using it as a rescue for very severe cases that don't improve with anything. And right now, it's used for compassionate use, but because the majority of the children with autism don't need stem cells to improve. They improve with other protocols that decrease inflammation. I have, I would say 10% of my patients that don't improve with anything because their metabolic problem is very severe. And this is where stem cell brings hope that it could contribute, because they're brand new cells, they're not differentiated, that will help me also decrease inflammation. But I want to make sure that people understand that this is under study, that there is not a clinical study already that has been proving this across the board. Duke University has been doing some great studies, and around the world, in Israel and other countries, I have seen studies that prove the efficacy or improvements in cognitive skills, socialization, but we're in the process of clinical studies, and that has to be understood. Obviously, it's being applied for other conditions like rheumatoid arthritis, like Parkinson's, diabetes type 1. Those are spinal cord injuries, heart disease, and the studies demonstrate promising results in all these things. And but the FDA only is recommending it for very serious cancer, very serious conditions. That's the only FDA approved indications. The other indications that we're referring to are under clinical investigation. And this is what we're talking about. This is a review of the outcome of the studies that we have seen with stem cells. And there's statistical significant results in some patients. And the analysis of those studies, especially the first phase of the Duke study, which is the only one that has been published, showed improvement in some patients, not so much in others, but they mentioned that it has to do with finding the right dose, and also to repeat and have higher amount of patients so that we can see the trend. But yes, it's promising, and the studies that present progress are there, and it's statistically significant. And this is just a slide that goes summarize the findings that I just mentioned. And the IMPACT clinical trial, which I'm looking forward to see the results, is underway. And it's aiming actually to prove the effectiveness in social and communication skills diagnosed with autism. I'm going to talk about a few case studies just to give an idea of what is the real case of what I see. And this is a 2-year-old with autism. He only said like 15 words, 10 words with purpose, involuntary movements, visual contact only 10 seconds, salivating, a lot of oral motor delayed, hypotonia, which I see a lot. And actually I see significant amount of patients that are diagnosed with carnitine deficiency, which carnitine doesn't improve. And there was a study years ago that provided evidence that the carnitine deficiency is the result of all these problems with the metabolism and not the cause, which explains why like 80% of my patients diagnosed with carnitine deficient don't improve with carnitine. And this patient was in occupational therapy twice a week and speech therapy times 3 a week. We did a very thorough evaluation, and we found he had severe speech delay, fine motor delay, sensory integration problems, socialization problem, but very importantly, we found he had primitive reflexes present. What are primitive reflexes? Primitive reflexes are involuntary movements that babies have in the first year of life that should be gone by 1-year-old. I use it as a tool to know what happened in that first year of life, and if they skip areas of development that are affecting our progress now. And in this child, for example, we test for 12 reflexes and he had them all present. Then we did a medical evaluation. We did lab testing that showed that he had mutations that affect neurotransmitter production, the immune system, and the detoxification pathways. And this is important because obviously there are trillions and trillions of chemical reactions in our body, and our body depends on those chemical reactions. But finding out that he has those mutations helped me to design protocols to help the body compensate. It's not that the body doesn't produce neurotransmitters, it's that whenever it needs more amounts, the neurotransmitter amount was not enough, and I was able to help the body support the biochemical pathways to produce more, and we saw it in clinical progress. The food sensitivity, we found food sensitivities in this child, and we have some guidelines that we can share with you of what we have found through the years that it's most common. But I always encourage the parents to use this as a guide and also the lab work and just see and do the experiment of in vivo food sensitivity testing. And that for me is the gold standard. Nutritional deficiency, we see a lot of vitamin D deficiency. We see significant amount of metabolization problems affecting vitamin B12 and folate, like I said before. Again, this child had dysbiosis. That was what I was talking about the overgrowth of candida. And very important, we saw oxidative stress. And what that means is the mitochondria, which is our organelle that produces energy in our cells, was not working well. So we started him in a program of 6 months where we intervene with all these things and help his body to recover. And this child in a 6-month period was speaking in sentences. Actually, he started to read 4-word sentences. His visual contact improved to 50 seconds. All the primitive reflexes integrated. His attention improved from 2 minutes to 15 minutes. And this was only in 6 months. So that's the recovery rate that I want to see. And I'm going to share with you what we have seen through the years. And this is children that were from 5-year-olds to 32 years old in a 3-month program where they received 3 sessions of 1 hour a week for those 3 months. And this is an average of what we saw in their results in gross motor skills, fine motor skills, cognitive speech and language, social emotional, and sensory. The same goes with patients. These were patients from 2 years old to 32-year-olds that did a 6 months program. The first one was 3 months. This is 6 months. And this is the improvements that we saw in average on those patients. And 20% of our patients with autism from 5 to 18 years old, we see incredible results. We see amazing results. And it has to do with finding the right diagnosis. And actually what we found is that when we're able to control that neuroinflammation, they improve significantly more than the patients that biochemical problems are not so well controlled. But this is 20% of our patients that do this, and it's amazing to see. So the key to this and why all our patients improve is because we're always monitoring and we're changing the program according to results. And we want to encourage every parent that sees this presentation to never give up and change until they find the results that they're looking for. Because the good news is there's treatments. It's just a matter of how hard it's to find. And all the patients, I just had recently a 22-year-old nonverbal that had a cognitive capacity of around 2 or 3 years old, that for the first time in 22 years, he's saying his first words. So the brain develops no matter the age. Obviously, it's harder when they're older, but never stop advocating for improvement. It's my message. So now we're going to allow for questions. Please feel free to let us know by text, or we can allow you to ask questions now. And thank you again for watching.